Welcome to the program. I'm Stephen Stone, Trent University Chancellor and proud alumnus. This week on Trent Talks, we'll be discussing the global impact of the COVID-19 pandemic on gender and economic justice. Now, we'll be focusing largely on the global south, developing countries. But I think you'll find that some of the issues we'll be exploring, specifically how individuals' race, social, and economic status is affected, these issues may well have reflections here in Canada and absolutely may be contributing to the roots of the uprisings that are now happening to our immediate south in the United States. So this is all extraordinarily timely. And I do want to acknowledge that we as individuals and communities are facing the ugly truths of racism, that as human beings, it remains a significant failing. And as a society, remains an absolute imperative to address. So as we engage in this edition of Trent Talks, I urge all of us to support each other and continue our hard and essential work to become a more just, safe, and supportive world. Now, joining us today are members of the Trent faculty, Dr. Haroon Akram-Lodhi and Dr. Colleen O'Manique. Dr. Akram-Lodhi is a professor of international development studies and economics. His interests include, among other things, feminist development economics, political ecology, and sustainable rural livelihoods. And Dr. O'Manique is a professor of international development studies and gender and women's studies. Her areas of research include gender and global restructuring, global political economy of health, health governance, and security. Before we begin our discussions today, could we first please respectfully acknowledge that Trent University is located on the treaty and traditional territory of the Mississauga Anishinaabe. We offer our gratitude to the First Peoples for their care for and teachings about our earth and our relations. May we honor those teachings. Thank you, Haroon and Colleen, for taking the time to lend your expertise to this episode of Trent Talks. Before we get into the questions from our audience, Haroon, maybe you could start us off by providing some insight as to how the pandemic is affecting developing countries.
Well, thanks very much, Stephen. Well, the COVID-19 pandemic, I think, ultimately has to be seen as a crisis of global human inequality. It doesn't matter if you're in Peterborough or if you're in Pretoria or if you're in Phnom Penh. If you have a white-collar job like the three of us, we're inconvenienced by the pandemic, but we're doing reasonably okay. But if your work is low paid and is insecure and you struggle to get by from paycheck to paycheck, there's a very good chance that you're one of the hundreds of millions around the world who've lost their jobs. And this is especially the case for waged workers in developing countries working in the informal sector. For low-waged informal workers in developing countries, there's no social protection to catch them. There's been very little by way of government support, and the pandemic for them is an immediate livelihoods crisis. And I should also say that at the same time, we have seen companies in North America like Walmart and Amazon benefit from the crisis. And so we've seen highly insecure incomes along with increased profitability for some companies. And this is two sides of the same coin, that of global human inequality, which is so starkly revealed by the pandemic, and the impacts of which we do see playing out so vividly in the crisis that we see in the United States right now.
Well, thanks, Haroon. And Colleen, could you provide some grounding for us on how issues such as gender perhaps magnify the impact of the pandemic, especially in the global south?
Yeah, sure. I completely agree with Haroon that the current pandemic is a crisis of global inequality. My research has analyzed the ways in which states have responded to previous global health emergencies, such as HIV/AIDS, SARS, H1N1, and Ebola. And what is clear is that responses can intensify existing inequalities, both within and among countries. One's geographic location, one's socioeconomic status, one's race, and one's gender can shape vulnerability to novel disease epidemics. So some of the questions that I focus on are whose bodies are more prone to infectious diseases, who has access to the social determinants of health, in addition to healthcare and medicines, who shoulders the social, economic, and cultural burdens of the disease, and whose bodies are left out altogether in responses to global health emergencies. A gender analysis that includes a critical analysis of race and class is really important to answering all of these questions.
Well, thank you. You both importantly set the stage with the context for today's discussion. These issues are indeed complex and perhaps not always top of mind. Okay, here are some questions submitted by our audience, and maybe first to you, Haroon. The Canadian and provincial governments have been offering economic stimulus and relief packages, things like wages for those finding themselves unemployed, funding or loans for small businesses, and more may be announced over the coming weeks. But developing countries do not have the same fiscal and monetary capacity as we do here in Canada and other developed countries. So here's the question: how have developing countries responded to the crisis?
Well, it's certainly true that developing countries don't have the fiscal capacity to launch economic stimulus packages of the sort that we've seen here in Canada, really quite extraordinary packages, not just here, but also in the United States and in Western Europe. And this inability to have stimulus has reinforced the insecurities of workers around the developing countries who've lost their jobs. But that really doesn't mean that governments don't have the ability to act. Responding to the COVID-19 pandemic is a political choice for any government, including those in developing countries and countries like the United States and the United Kingdom. And how governments respond reflect their priorities. Some developing countries have been able to very quickly flatten the curve and avoid a health crisis. Senegal, for example, had an outstanding record in responding to the HIV/AIDS crisis, and it learned the lesson as to how to manage a health crisis, and it's done very well. But conversely, some countries have denied there's even a crisis and have even tried to hide its impact. Tanzania here comes to my mind in that case, where reports of excess deaths are actually being treated as state secrets. The capacity of both developed and developing countries to respond to the pandemic, then, is more a function of political will of the country's leadership than just fiscal capacity.
Yeah, I agree with Haroon. The state of Kerala in South India has also done a great job of containing the epidemic, their epidemic, as has South Africa. But what we are seeing is that the impacts are highly variable, especially in countries with less robust social safety nets, as well as in countries with higher numbers of informal workers in the economy.
Yeah.
Many have completely lost their livelihoods. Women are overrepresented in the informal economy, and some of the hardest industries globally, such as textile and garment production and domestic labor, are very much vulnerable to labor market downturns. And even not just in the global South, we see in Canada and in the US that we are not equally vulnerable to the impacts of COVID-19. Frontline health workers around the world are mostly women, and the pandemic has exposed how deeply undervalued the critical labor of largely racialized women in long-term care homes is. In fact, the daily and generational labor of keeping people healthy and alive is largely invisible and undervalued throughout the global economy.
Yeah.
And we see this in the United States. The African American population has been disproportionately affected from COVID-19 because of structural racism.
And Colleen, I've got another question from the audience, but just for me, when you talk about the informal economy, what do you mean by that?
Well, the informal economy is essentially the economy that lies outside of what we would consider to be the formal wage economy. So and in a sense, and I don't want to get into too much detail here, and maybe Haroon, as an economist, can answer this question, but certainly the formal and informal economies are tightly integrated. But Haroon, maybe you want to say a few words about that.
Sure. The easiest way of thinking about the informal economy is these are businesses which aren't registered with government. So they don't pay any taxes, but they also don't necessarily have to pay any social payments to the workers. Workers can have very insecure terms and conditions because they're not governed by labor law. The vast majority of people's employment around the world, but particularly in developing countries, is in the informal economy, where people don't get the benefit of any rights.
Okay, well, thank you for that. And we'll get back to our audience questions. And Colleen, staying with you, we know access to healthcare is important for a healthy community with or without a pandemic. And within Canada, we've got a public healthcare system, and we see disparity even there in terms of access between city centers, rural areas, and Indigenous communities. In the United States, with private healthcare, African-American communities and poorer neighborhoods are being hit harder than wealthy parts of the country. So how is this disparity playing out in the developing world?
Well, in the developing world, large urban centers have always been better served by healthcare services. That's where the hospitals are located. The healthcare systems in most former colonies have been shaped by colonial legacies. But there have been attempts to decentralize healthcare. The Healthcare for All by the year 2000 campaign, led by the World Health Organization in the 1970s, placed primary healthcare at the center of addressing healthcare for all. And they defined health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And this is a definition that still circulates in global health policy circles. Healthcare was also declared a fundamental human right and a worldwide social goal, requiring the action of other sectors of governance. But this was short-lived. It was replaced by selective primary health care and privatization with the neoliberal turn.
It's true, as Colleen says, that many developing countries have much weaker healthcare systems than those of Canada, the United States, or the European Union. This is especially true for people living in the countryside in Asia, or for most of sub-Saharan Africa. But within the context of much weaker healthcare systems, governments can still do something. Colleen's already mentioned the Indian state of Kerala. I would mention Vietnam. And in both places, we can see that governments can still do quite a lot with a little. Vietnam has a per capita income that is a tenth of that of Canada. It's got 3 times our population, but it has had no deaths directly attributed to the virus. So how has it been able to do this? It instituted mass testing and tracing early on in the pandemic in the middle of January. And anyone who did become infected was isolated completely, taken out of circulation by being moved into isolation centers immediately. And Vietnam has been incredibly successful in handling the pandemic. So disparities between developing and developed countries, they're real. Of course they're real. But again, even countries which don't have the kind of healthcare systems that would be ideal can still do a lot if they make the correct political choices.
Mm-hmm.
And Haroon, staying with you for this next question, it's commonly said in social science that we've been living for several decades in a neoliberal world. First of all, what is neoliberalism? And how has it affected the health systems of developing countries?
Sure. Well, neoliberalism is simply a belief that markets work better at meeting human needs than governments. And so governments really need to get out of the way of markets and let markets work. And as a result of this belief, in the 1980s and in the 1990s, healthcare budgets were cut dramatically in many, many developing countries. Now, the problem with this kind of a belief is that it requires everyone to essentially look out for themselves and buy what they need, including healthcare. But what happens then if you don't have the money to spend because you're poor? You're then denied access to the health services that you need. And so the pandemic shows us that denying healthcare to people because they are poor, because they don't have money to spend on healthcare, actually magnifies and amplifies the spread of the transmission of the disease. Poverty itself has a comorbidity with the virus, and neoliberalism has not solved the problem of poverty. And in so doing, it has contributed to the spread of the pandemic.
Yes, absolutely. And what we will see is excess mortality and morbidity, not just from COVID-19, but other diseases that are left untreated as already strained healthcare systems become overwhelmed. Neoliberal policies have included cutbacks and the privatization of healthcare, but also the rise of other policies that impact health and life chances. Wealth inequality continues to grow along with the increasing precarity of livelihoods. Many households are already carrying very heavy debt loads. And this was when the virus emerged. These households are now risk falling into critical poverty. Austerity measures have eroded the social safety nets where they did exist, and now that they're needed, we find that they're inadequate. As well, women have had to fill in the care gap as daycares and schools have closed, and other services have been disrupted. When households are resource scarce, it is largely women and girls who eat less and do more of the care labor. And we already see higher levels of gender-based violence in households under quarantine.
So you just talked about women having to fill in the care gap, and we've seen some headlines recently, for example, from The Guardian. And they state that the pandemic could set women back by decades. And let me quote briefly from The Guardian. In a week during which it was revealed that women are bearing the brunt of extra childcare and housework and are losing jobs in greater numbers than men, campaigners, politicians, and work experts said a dearth of female voices at the heart of government also risks putting 50 years of progress into reverse. So what does this mean, both for Canada and for developing countries, that women's rights have not yet been fully realized and indeed may be at risk of unraveling?
Well, human rights everywhere are far from being realized, including the human right to health. The vast majority of people on the planet are unable to exercise their basic rights to healthy food, to clean water and sanitation, to breathable air, to adequate housing, security from violence, bodily autonomy and integrity, not to mention access to public health care and medicines. So yes, indeed, the pandemic could further erode women's rights. But I also think it's an opportunity to prioritize in the economic recovery that hopefully will unfold the essential human labor of keeping people healthy, both physically and mentally, which also includes prioritizing a healthy environment. What this pandemic has done is it's exposed how the most important labor in the global economy is invisible, devalued, feminized, racialized, as well as taken for granted.
Colleen said that women's labor underpins the way an economy operates. And this is really seen very much so when we think about how an inability to realize women's rights could really have very profoundly negative effects. In sub-Saharan Africa during the HIV/AIDS crisis, it was women, of course, who had to undertake the home health care by looking after those who were seriously ill. And when they had to undertake that home health care, what this meant was that they didn't have the time to work on their plots of land, which they were farming to grow food for their families, or they didn't have the time to be able to go out and earn some wages from some informal work. And women's incomes are so important to household livelihoods that when women are unable to work for wages or produce crops to feed their families because their caregiving responsibilities have gone up, this reduces the living standards of other family members, including children. And that reduction in family living standards in turn increases the risks of being susceptible to diseases like the virus. So women's labor is absolutely central to understanding not just how families are trying to cope with the pandemic, but the inability to realize women's rights is also will be fundamental in shaping how we move out of any kind of crisis.
Well, and Haroon, you mentioned sub-Saharan Africa. Effective testing and tracing for the virus which causes COVID-19 is limited there. So what do you think might be the possible long-term effects of the virus on African populations?
Well, Stephen, I would start by saying that I don't think as social scientists our job is to predict the future, because I think that's inherently risky. But all we can sort of do is try and tease out trends from what we do know. So what do we know? Well, I've already mentioned the fact that we could expect some loss of agricultural production because women will have to withdraw from farming in order to be able to look after family members. As well, there'll be less work in towns, less work in the countryside, and so lower incomes from that loss of waged work. And between those two factors, we would expect some increase in food insecurity. Now, in that kind of a context, it's really important to increase social protection for vulnerable populations, to create conditions in which livelihoods can be sustained in times of crisis, and ensure that food systems are operating so that food is getting to people, particularly in remote or rural areas. Now, the ability to do this reflects how seriously governments are willing to support their citizens. Governments in sub-Saharan Africa, of course, lack the fiscal capacities of countries like Canada, but there are certainly ways of using limited resources far more effectively to meet social needs than currently the case. But they do need, at the same time, far more resources, and it is incumbent upon us to try and ensure that more resources become available to resource-constrained governments in sub-Saharan Africa.
Yeah, I agree with Haroon. We don't see effective testing and contact tracing across the globe, but particularly in the global south.
Yeah.
It also hasn't been great in Canada, by the way, as well. And we're actually not too far behind the United States in terms of deaths per 100,000 people.
Yeah.
However, the consequences in places where healthcare systems are already fragile and other diseases are endemic could be dramatic as well. So if hospitals and healthcare clinics do become overwhelmed, the collateral damage could potentially be more deaths from a whole range of conditions that are left untreated. And we could also see a move backwards in terms of the sexual and reproductive health rights for women and girls. During the height of the HIV/AIDS pandemic, it was women who shouldered the burden of care for sick family members, and primary caregivers to the sick are at most risk of infection.
Well, thank you. We now have a final question from the audience, and this goes back, I think, to one of our previous questions. Will the neoliberal, the private market-based development policies affect the economic and social recovery globally? Will we, I guess another way of asking that, will we need to shift away from such practices in order to bring about a recovery?
Well, Stephen, I've already suggested that developing country governments lack the fiscal capacity to develop the social and livelihood policies that they need to be able to foster recovery. Sure, they can do more with what they have, but they do need more. And the fact that these policies try and constrain the fiscal capacities of governments, that's going to impede the capacity of developing countries to recover from the pandemic in general. So there is a need to shift away from these sorts of policies, as many of us have been saying for decades. if we want to bring about some kind of sustainable recovery in human development.
Yes, absolutely. And I think we need to acknowledge that a global economy cannot function until global finance is reined in and regulated and taxed. The grotesque equality that is only getting worse during this pandemic really needs to reverse, and everyone's future depends on this.
Some somber remarks, and well, that's all the time we have today for our audience submitted questions. Maybe turning it around a little bit, there's a final question I always like to ask. Are there any positive lessons that we can take forward from this pandemic time? And Haroon, maybe you first.
Sure. Well, the pandemic clearly shows us that global inequality is inimical to human health. And at the same time, we already know that global inequality massively contributes to climate change. So I think that the key lesson that the global community, global citizens like ourselves, can learn from this pandemic is that there's a deep underlying need that human inequality finally be definitively addressed. Because, of course, inequality is not inevitable. It's a political choice that threatens the future of the planet. And by challenging global human inequality, we can lay the foundations of a better future. And given what we've seen in the United States, south of the border in the past few days, we do need a better future if we're going to have a more equitable future.
Indeed. And Colleen, is there a hopeful message you can leave us with today?
I'll try. I think we need to acknowledge that the world needs to shift away from a regime of global health security that focuses on emergency response and containment, while largely leaving the conditions that underpin health emergencies intact. We need to pay serious attention to the material conditions that nurture viral contagion and the impacts of pandemics on the most vulnerable. But I think the larger political project involves challenging the legitimacy of a global governance system that is accountable not to flesh and blood bodies, but to corporations and shareholders. It's also important at this historical moment to point out that the chronic endemic diseases of poverty do not have the potential to disrupt economies the way that these public health emergencies, these global health emergencies have, nor do they pose a threat to the wealthy. And hence they have become a global priority. So my hope is that what really comes out of this pandemic is an economic recovery that focuses on what really matters to the health of all humanity, as well as other creatures on the planet. And I think this is the first pandemic where you really see these questions really being taken up in the mainstream media. They haven't been taken up in previous pandemics, but I think that people are mobilizing. They want to see a better future and a more healthy future for everybody.
Well, and amen to that. Thank you, both of you, Colleen and Haroon, for your insights today. It was really, there's so much to go into, and you managed to distill it so well. And for those of you at home, thank you for joining us, and I hope we'll see you again next week. In the meantime, we can keep the conversation going on social by using the hashtag Trent Talks. So until next week, stay safe, and please always remember you are not alone. Goodbye for now.